my topic for today is about the immune system. So, the immune system functions as the body's defense mechanism against invasion and allows a rapid response to foreign substances in a specific manner. So, the term immunity refers to the body's specific protective response to a foreign agent or organism, while the term immunopathology refers to the study of diseases that results from dysfunction within the immune system. So these are the immune organs. Supporting this system are molecules are responsible for the interactions, modulations, and regulating of the system. These molecules and cells participate in specific interactions with immunogenic epitopes present on foreign materials, initiating a series of actions in a host, including the inflammatory response, the lysis of microbial agents, and the disposal of foreign toxin. So the major components of the immune system include the central and peripheral organs. So we have here the major components. Unang-una is yung ating bone marrow, which is the production site of WBCs involved in our immunity. The B lymphocytes and the T lymphocytes. The P lymphocytes mature in the bone marrow and then enter the circulation. The T lymphocytes move to the bone marrow to the thymus, where they mature into several kinds of cells capable of different function. So the leukocytes provide protection through the following defense mechanism or reaction, which is the recognition of self from non-self, phagocytosis, lytic destruction of foreign invaders and unhealthy selfless cells, production of antibodies directed against invaders, complement activation, and also the production of cytokines. So, ano nga ba yung self from non-self o yung self versus from non-self? Ito yung pag sinabing self-tolerance is possible because of the different kinds of proteins present on the cell membrane. And these unique proteins, which is yung HLA, found on the surface of all the body cells of that individual, serve as the universal product code or cellular fingerprint for that person because they are non-self to other person's immune system. They are considered antigens capable of producing an immune response. And then, next is the lymphoid tissues. Include the thymus gland, spleen, lymph nodes, tonsils, and adenoids, and similar tissue in the gastrointestinal, respiratory, and reproductive system. So, ito yung ating lymphatic system. Our immune function and defenses responses. So we have here the three processes needed for immunity: the inflammation, antibody-mediated immunity, the cell-mediated immunity. So the types of immunity: natural or the innate immunity, a non-specific response to any foreign invaders regardless of the invader's natural composition. It has the ability also to distinguish self from non-self. So, the natural mechanism includes the physical and chemical barriers. Ito yung includes our intact skin, mucous membranes, and the cilia of the respiratory tract. While the chemical barriers includes acidic gastric secretions, mucus, enzymes in tears and saliva, and substances in sebaceous and sweat secretions. Next is the white blood cells action or the leukocytes. So the neutrophils, the most abundant type of WBC, first cells to arrive at the site where inflammation occurs. And then the eosinophils, these cells are more durable than neutrophils, make up 1 to 2% of the total WBC, acts against infestation of parasitic larvae. So, yung ating, sa neutrophils din also, contains granules that destroyed invaders by phagocytosis. Yung ating eosinophils naman po, their granules contains substances that induces inflammation. Sila yung release kumbaga. Also help terminate allergic reaction. So sila din, pag mataas po yung eosinophils natin sa ating WBC, usually ito yung mga allergic may sign na allergic reaction nangyayari. So ito po yung itsura ng WBC natin. Next, the basophils and tissue mast cells make up 1% of the total WBC. The macrophages or the monocytes functions as phagocytic cells to engulf, ingest, and destroy foreign toxins. So, ito lang yung mga kumakain ng mga foreign body natin sa katawan. The lymphocytes, classified as B cells or T cells. B cells function in antibody-mediated immune responses, helping to defend the body against invasive types of bacteria, bacterial toxins, and some viruses. The T cells naman are the basis of cell-mediated immune function that defends against facultative and obligate intracellular pathogens, fungi, and viruses. So, the inflammatory response provides immediate protection against the effects of tissue injury and invading proteins. So, pag may inflammatory response, we have 5 cardinal manifestation. The warm, redness, swelling pain, and decreased function. We have also, it helps also the start both antibody-mediated and cell-mediated action to activate a full immune response. So, meron pa akong ginawang dito, parang simple pato lang po ng inflammatory response. Pag meron po tayong constriction of blood vessels occur immediately after the injury, lasting only for a few moments, followed by dilation of small vessels occurring as a result of histamine released by the injured tissue. Thus, more blood flows to the site of injury. Then, there will be a vascular permeability increases at the injured site with the release of chemical mediators natin, which is the bradykinin, serotonin, prostaglandin, and histamine. And then, the plasma fluid leaks to the inflamed tissue, resulting to swelling and pain. And the blood slows into the dilated blood vessel, which helping more leukocytes move to the site of injury to engulf offending organism and remove cellular debris through phagocytosis. So next, the exudate production, which is consists of fluid that escape from the blood vessels. Which ito yung mga dead phagocytic cells and dead tissue cells products that they release. So, the fibrinogen, thromboplastin, and platelets together form on interlacing network to make a barrier wall of the area and prevent spread of the injuries agent. And then the reparative phase or reparative phase, which is the injured tissue by generation or replacement with fibrous tissue formation. So, yung next natin is acquired immunity, which is immunologic responses acquired during life but not present at birth. Usually develops as a result of prior exposure to an antigen or by contracting a disease. So we have 2 types of acquired immunity: the active acquired immunity and the passive acquired immunity. The active acquired immunity, the immunologic defenses are developed by the person's own body, where the passive is temporary immunity transmitted from another source that has developed immunity through the previous disease or immunization. Then response to invasion. So the phagocytic response, the first line of our defenses. So occurs when the WBC moves to the point of attack where they engulf and destroy the invading agents. Eosinophils also kills parasite by releasing specific chemical mediators into the ECF such as leukotrienes, prostaglandins, and various cytokines. So the stages of phagocytosis. First, when there's a exposure and invasion, phagocytosis is triggered by injury or invasion. And then, the phagocytosis can only occur when the WBC comes in direct contact with the target. And then the chemotaxins or leukotaxins secreted by damaged tissue, blood vessels, and found on the surface of invading antigen or foreign proteins acts as chemical magnets that attracts neutrophils and macrophages. And then the adherence, when the phagocytic cells bind to the surface of the target, a process known as opsonization. So the opsonization from the word opsonin, which means to cover food with sauce before eating. And the opsonins coat a target cell, which make it easier for the phagocytic cells to stick to it. And then the complement activation and fixation. This is the one type of opsonization which, when inactive complement proteins made by the liver and are present in the blood, are activated and surrounds antigen, fixes or stick to the antigen. Next is the recognition. After sticking into the surface of the target cells, it recognizes the non-self by examining the universal product codes of whatever they encounter. And then the cellular ingestion, this target cell is brought inside the phagocytic cell. Once the target cell is enclosed inside the phagocytic cell, a vacuole is formed. Next is the phagosome formation. The phagolysosome form once the phagocytes granules enter the vacuole. These granules break and release the enzymes to destroy the ingested target. Degradation enzymes in the phagosome digest the engulfed target and is broken down into smaller pieces. Some of the pictures illustrated the opsonization and phagocytosis. Next, the antibody-mediated response, also known as humoral immunity. It involves antigen-antibody interactions to neutralize, eliminate, or destroy foreign proteins. Cells with the most direct role in antibody-mediated response are the B cells. So the main function of these B cells are to become sensitized to a specific foreign protein and to produce antibodies directed specifically against the protein po. So next po natin is yung antibody classification, which is yung mga IgA, IgG, IgE, IgG, and IgM. So the IgG, which is the most abundant type of antibody, is found in all body fluid and protects against bacterial and viral infection. The IgA is found in high concentrations in the mucous membranes, particularly those lining the respiratory passage and gastrointestinal tract, as well as saliva and tears. IgM is found mainly in the blood and lymph fluids. It's the first antibody made by the body to fight a new infection. The IgE is associated mainly with allergic reactions. So, when the immune system overacts to environment antigen such as pollen or pet dander, It is found in the lungs, skin, and mucous membranes. The IgD, which exists in small amount in the blood, is the least understood antibody. Next is the hypersensitivity and allergy. An allergy is an abnormal individual response to certain substances that normally do not trigger such an exaggerated reaction. In some types of allergies, a reaction occurs on a second and subsequent contact with the allergen. Skin testing may be done to determine the allergen. Allergic disease are mainly IgE-mediated diseases that include allergic rhinitis, allergic asthma, allergic dermatitis, and food allergy. The precise causative factors of allergic diseases are not clear. It has been proposed that some people are genetically prone to develop allergic diseases. When these people encounter foreign antigens, then dendritic cells capture and process the antigen, transfer the antigen formation to T helper cells. A skewed immune response is induced that results in a Th2 polarization status in the body. These antigen-specific Th2 cells present the antigen formation to B cells and drive these cells to become plasma cells that produce antigen-specific IgE. These antigen-specific IgE sensitize mast cells by binding to the high affinity IgE receptors on their surface. When the sensitized mast cells are exposed to the specific antigen, they are activated to release allergic mediators such as histamine, tryptase, leukotrienes, and serotonin that initiate allergic attacks. Our assessment in hypersensitivity and allergy is history of exposure to allergens, itching, tearing, and burning of the eyes and skin, rashes, nose twitching, nasal stuffiness. For the interventions, identification of the specific allergen, and then management of the symptoms with antihistamines, natin, anti-inflammatory agents, or corticosteroids. Applying some of the ointments, cream, wet compresses, and soothing baths for local reactions. Desensitization programs may be recommended. Anaphylaxis. Anaphylaxis is a serious and immediate hypersensitivity reaction that releases histamine from damaged cells. Anaphylaxis can be systematic or cutaneous, which is localized. The priority nursing action is first, weekly assess respiratory status and maintain a patent airway. Call the health care provider or rapid response team, and then administer oxygen, start IV line, and then infuse normal saline. Prepare to administer diphenhydramine and epinephrine, depende sa order po ng doktor. And then document the event, actions taken, and the client's response. For the latex allergy naman, is a hypersensitivity to latex. The source of the allergic reaction is thought to be the proteins in the natural rubber latex or the various chemical used in the manufacturing process of latex gloves. Symptoms of the allergy can range from mild contact dermatitis to moderately severe symptoms of rhinitis, conjunctivitis, urticaria, and bronchospasm to severe life-threatening anaphylaxis. So these are some of the products that may contain natural rubber latex. The intervention for the client with a latex allergy. First, ask the client about known allergy to latex when performing the initial assessment. Then identify the risk factors for a latex allergy in a client. Use non-latex glove and all latex safe supplies. And keep a latex safe supply cart near the client's room. Apply a cloth barrier to the client's arm under a blood pressure cuff. Use latex-free syringes, medications container, and latex-safe intravenous equipment. Instruct the client to wear a medic alert bracelet. Hindi pa ako nakakita ng medic alert bracelet kung meron tayo po dito sa Pilipinas. And then instruct the client about the importance of informing healthcare providers and local and paramedic ambulance companies about the allergy. This picture illustrates on how our body reacts to an allergen. If the person is exposed to an allergen, the B cells react. So, a large amount of IgE antibody is made in the plasma cells, and then these IgE antibodies attach to mast cells. The next time the person is exposed to the allergen, it binds to the IgE antibodies that are attached to the mast cells. This triggers the release of our chemical mediators from the mast cells. So, kaya nagkakaroon po tayo ng sa intravascular compartment po natin, yung mga kung malala po yung allergy na nangyari, nagkakaroon tayo ng anaphylactic shock, ng mga hindi pa na-cure agad-agad. Sa skin naman, nagkakaroon tayo ng urticaria, atopic dermatitis. Sa ating respiratory system naman po, minsan nagkakaroon tayo ng rhinitis. Ito usually nangyayari sa akin din to. Asthma. GI system naman po, nagkakaroon tayo ng saya, vomiting, cramping pain, diarrhea. And then, immunodeficiency. Immunodeficiency is the absence or inadequate production of immune bodies. The disorder can be congenital or acquired. The treatment depends on the inadequacy of immune bodies and its primary cause. Our assessment, factors that decrease immune function, then frequent infections, nakaranas ba siya ng infection ng patient, nutritional status din ng pasyente, medication history such as use of corticosteroids for a long periods, history of alcohol or drug abuse. Acquired immunodeficiency syndrome or AIDS is a viral disease caused by human immunodeficiency virus or HIV, which destroys T cells, thereby increasing susceptibility to infection and malignancy. The syndrome is manifested clinically by opportunistic infection and unusual neoplasm. AIDS is considered a chronic illness. The disease has a long incubation period. Sometimes it takes 10 years or longer. Manifestation may not appear until late in the infection. So these are the diagnostics or tests used to evaluate if the patient has human immunodeficiency or HIV infection. Makikita po sa kanyang sa WBC is bababa po. So usually the white blood cells count normal to decrease po yung sa kanyang resulta. Sa lymphopenia naman, less than 30% of the normal number of WBC. Sa thrombocytopenia, there will be a decreased platelet count. Sa lymphocyte screen naman po, yung resulta po usually ng mga may HIV infection is reduced CD4 o CD8 plus T cell ratio. So CD4 naman, yung lymphocytes decrease po siya, and then the CD8 lymphocytes is increased. Sa quantitative immunoglobulin, yung IgG niya is mataas. Sa IgA naman po level frequently increase. Sa chemical panel po natin, like lactate dehydrogenase level are increased also. The serum albumin level also decrease. The total protein is increased. The cholesterol level also decrease, and AST and ALT levels elevated. In allergy panel, meron siyang non-reactive or poorly reactive to infections, agents, or environmental materials. Sa hepatitis B surface antigen testing naman po, didetect po natin if there's a presence of hepatitis B. Also in chest radiography to detect the tuberculosis. Our assessment, we need to check if the patient experiences malaise, fever, anorexia, weight loss, night sweat, fungal infections such as candidiasis, histoplasmosis, viral infections such as cytomegalovirus, herpes simplex, and other bacterial infections. So, the HIV is a retrovirus, meaning it carries its genetic information in RNA. On entry into the body, the virus infects cells that have CD4 antigen. Once inside the cell, the virus sheds its protein coat and uses an enzyme called reverse transcripta set to convert the RNA to DNA. This viral DNA is then integrated into host cell DNA and duplicated during normal processes of cell division. Within the cell, the virus may remain latent or become activated to produce new RNA and to form vivrons. The virus then buds from the cell surface, destructing its cell membrane and leading to destruction of the host cell. Although the virus may remain inactive in infected cell for years, antibodies are produced to its protein, a process known as seroconversion. These antibodies are usually detectable 6 weeks to 6 months after the initial infection. The helper Ts or CD4 cells are the primary cells infected by HIV. It also infects macrophages, dendrites, and certain cells of the CNS. Helper T cells play a vital role in normal immune system function, recognizing foreign antigens and infected cells and activating antibody or producing new cells. They also direct cell-mediated immunity activity and influence the phagocytic activity of monocytes and macrophages. The interventions in HIV is first to provide respiratory support, administer oxygen and respiratory treatments as prescribed, provide psychosocial support, maintain fluid and electrolyte balance, monitor signs for infection, prevent the spread of infection, and initiate standard and other necessary precautions. Next topic, autoimmune disease. Autoimmune diseases, which is the body is unable to recognize its own cells as part of itself. Autoimmune disease can affect collagenous tissues. The mechanism that causes the immune system to recognize host tissue as a foreign antigen is not clear. The following factors are understudied as possible contributors to the development of autoimmune disorder. The release of previous hidden antigens into the circulation, such as DNA or other components of the cell nucleus, which elicit an immune response. chemical, physical, or biologic changes in host tissue that cause self-antigens to stimulate the production of auto-antibodies. The introduction of an antigen such as bacteria or virus whose antigenic properties closely resemble those of host tissue, resulting in the production of antibodies that target not only the foreign antigen but also normal tissue. This is termed molecular mimicry, heart damage in rheumatic fever, and acute glomerulonephritis following beta-hemolytic streptococcal infections are examples of the development of antibodies against normal tissue. A defect in normal cellular immune functions that allows B cells to produce antibodies unchecked in initiation of the autoimmune response by very slow-growing microbacteria. In systemic lupus erythematosus or SLE, the chronic progressive systemic inflammatory disease that can cause major organs and systems to fail. Connective tissue and fibrin deposits collect in blood vessels on collagen, fibers, and organs. The deposits lead to necrosis and inflammation in blood vessels, lymph nodes, GI, and pleural tract. The cause of SLE is unknown, but is believed to be a defect in immunological mechanism with a genetic origin. The precipitating factors include medications, stress, genetic factors, sunlight or ultraviolet light, and pregnancy. This cold lupus erythematosus is possible with some medications but totally disappears after the medication is stopped. The only manifestation in the skin rash that occurs in lupus. Assessment for precipitating factors such as erythema of the face, which is meron siyang malar rash, also called a butterfly rash, dry scaly rash face or upper body, and then joint pain, usually photosensitivity sila, meron silang anemia, they also have weight loss. Usually may kaklase ako ganito siya, weight sobrang payat niya. Positive anti-nuclear antibody or ANA test and lupus erythematosus preparation, elevated erythrocyte sedimentation rate or ESR, and C-reactive protein level. The intervention in SLE is to monitor skin integrity and provide frequent oral care. Instruct the client to clean the skin with a mild soap, avoiding harsh and perfumed substances. And then assist the use of ointments and cream for the rash as prescribed. Identify factors contributing to fatigue. Monitor intake and output also, as well as the daily weight for signs of fluid overload or dahil sa corticosteroid na paggamit nila. And then, note that lupus nephritis occurs nearly in the disease process by provide supportive therapy as major organs become affected. Provide also emotional support and encourage the client to verbalize feelings. Note po natin na sa client na may SLE, usually we should monitor the blood urea nitrogen and creatinine levels frequently for signs of renal impairment po. So, yun lang po ang aking report about the immune system. Thank you po sa pakikinig.